penetration of brain and placenta needs a special mention because it is not as usual to other sites. Consider this is the normal blood vessel outside the brain, outside CNS. So what will be there? It will be having this space, paracellular spaces through which, so the drug can move through this is lipid soluble only, or through paracellular if the drug is lipid insoluble. But what will happen in case of cerebral vessels? Consider this is cerebral vessel. Okay, these are very tightly arranged, there is no gap between the cells. There is no gap between the cells, no gap. Okay, no gap between the cells. Further, there are glial cells which cover this, providing further protection. Okay, glial cells covering this, providing further protection. Apart from that, there are proteins, for example P-glycoproteins. P-glycoprotein, which will, if the drug comes, it will pump out the drug back. And apart from that, there is also this enzymatic blood-brain barrier, enzymatic BBB. What it will do? It will, for example, monoamine oxidase, cholinesterase, it will metabolize whatever is coming. So hence transfer of drug to brain is very difficult. Passage across placenta, it is also similar to that of blood-brain barrier, but only thing you have to know it is that it is incomplete barrier. Incomplete barrier, it almost any drug taken by mother can affect the fetus. Okay. Again the same things, like it is also lipoidal, lipid soluble drugs will be crossing. It has also efflux transporters like P-glycoprotein, breast cancer resistant protein, multi-drug resistant protein 3. But if you remember, you might be knowing like in first trimester most teratogenic effect of drug is seen. In earlier pregnancy, drug will cross placenta and cause teratogenicity. But if I ask you quantity wise, more drug will be crossed at during which stage? During early stage more drug will cross placenta, or during late stage more drug? During late stage. Why? Because as the pregnancy advances, uterine blood flow increases, and if the blood flow increases, drug will also pass more. Now if you know this thing, heparin and insulin, these are the drug of choice in pregnancy. Why they are used? Because they are relatively large and they do not cross placenta. Placenta is also site of drug metabolism. And one important thing which has been also asked as question is this thing: the mother's pH is 7.4, but fetal's blood pH is slightly acidic. So what will happen? If a basic drug enters into acidic pH, it will get trapped. So trapping of basic drugs will occur in case of fetus. Okay, this has been asked as MCQs. Okay, this point has been asked as MCQ, and this has also been asked. And one more option was it contains P-glycoprotein like this, etc.